have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to Medical Files, brought to you by the Islamic Medical Association of South Africa. I'm your host tonight, Dr. Arshad Bhayat. We on air after quite a long time at this time slot, and we hope that our listeners with us today. I'd like to welcome all the listeners from across the country, our Al Ansar listeners, our IFM, Radio Islam International, Channel Islam International, Voice of the Cape, Radio 786, and Sirius FM. A warm welcome to one and all of you. Today our guest is Dr. AFZAL Khan and Dr. ZAHEERA CASSIMJEE, both nephrologists, and we're talking about prevention of kidney disease. Also, we must, most of you know that last week was World Kidney Awareness Week, and we're going to be talking a little bit about that. We're going to be talking about the importance of recognizing kidney disease. We're going to talk a little bit about chronic kidney disease, and if there are any questions, queries, or any doubts that you may have, please, we have two experts in the studio today. And you can send through your message on 060-904-1056. The number again is 060-904-1056. Welcome, Dr. AFZAL Khan and Dr. ZAHEERA CASSIMJEE.
Thanks very much.
Right. So, we always hear about awareness for cancer, and then, they talk a lot about awareness about heart disease and how to do lifestyle changes, etc. But somehow the other kidneys seem to be relegated to a position that people feel that it's not really important to take note of the kidney and what the kidney is doing to the body. What advice can you give to patients regarding this awareness?
Well, you see, the the World Kidney Day on the 12th of March was to highlight how common kidney disease is, as chronic kidney disease, and the fact that patients are not often aware until it's very late. So it's commoner than you think, and it's a global problem, not limited to South Africa. There are a few common causes. There are some very basic tests that can be done, and chronic kidney disease is it can be classified stage 1 to 5, mild, moderate, severe. Stage 1 and 2 is early, and that's the stage we really want to get the patients, because there's a lot we can do at that stage. And as the kidney disease progresses to stage 4, 5, and some other form of treatment is required, like dialysis and transplant. But what World Kidney Day tries to emphasize is that we need to pick up early kidney disease, and also patients who don't have kidney disease, try and keep people from getting kidney disease. And that's basically a healthy lifestyle. And Dr. CASSIMJEE will tell you about the primary. She's got some notes there about primary prevention of kidney disease.
Okay, Dr. CASSIMJEE, you can go ahead.
So, as Dr. Khan said, it's often silent in the early stages, which is a problem because it can progress to very severe health consequences like end-stage renal disease needing dialysis. And it's the people at risk that should actually test. So hypertensive patients, diabetic patients, older patients, if you have a family history of anyone on dialysis or kidney disease, it's important to test yourself. How to prevent it? If you are hypertensive, control your blood pressure. So at least, if you know your numbers, at least 140/90 or less, or even less than that, 130/80. Diabetics should control their sugar. You need to maintain a healthy weight, exercise regularly. And one of the most important things people can do to prevent kidney disease is avoid unnecessary medications like anti-inflammatories. That's one of the most common causes of acute kidney injury that we see in practice. People that take the Voltaren and Brufen, they take gout cocktail together with their blood pressure tablets and then end up having kidney damage because of that. So just to be aware of what medication you're taking as well.
Yeah, it's interesting that you mentioned that because, a lot of our patients over the age of 60, especially in, the central part of the country where it gets pretty cold during the winter season, they basically can't manage without these tablets. And so what other things can they use? What can they substitute this with?
So it's not an absolute no. If you absolutely need an anti-inflammatory and your kidney function is okay, then that's okay for short courses. That's okay. But if you're at more at risk, so say you have high blood pressure and you're on certain types of medication, particularly, something we call ACE inhibitors, a type of blood pressure medication. If you combined that with an anti-inflammatory, you severely cut down the blood flow to your kidney. So just be aware of what blood pressure medication you have. We often say if it's not paracetamol or Panado is not enough, then codeine-based painkillers are usually the next step. Obviously, they don't work as well as anti-inflammatories, but it's a smaller price to pay than having to end up on dialysis or having advanced kidney disease.
Okay, so you mentioned that the high-risk groups are those that are diabetic, that are hypertensive, and those that have a history of kidney disease in the family. But something that's very relevant in this day and age, especially amongst the younger generations, is there's a lot of abuse that's going on. A lot of drug abuse, a lot of abuse of drugs that are used for aesthetic purposes, like your bodybuilders and guys like that. So those two main classes, your narcotic drugs, your drug addicts, and those that are experimenting with drugs, and those that are bodybuilders and that are using a whole lot of supplements which they're not even sure what it is. And what can you tell us about those two groups of people and kidney disease?
I think you're talking about the use of anabolic steroids. Anabolic for building muscle bulk. Now those have many problems, not just kidney related, but hypertension, endocrine abnormalities, mental changes, changes in liver function, changes in the patient's mood, skin acne. So the anabolic steroids is a problem. You didn't mention, I think also you want to ask about proteins, shakes and proteins.
Protein shakes, your creatine, so many, all those bulk builders.
Now, a high protein diet is a problem for the kidneys to function normally. It's like you're driving a car with your foot flat down on the accelerator. Now, a normal healthy person with no medical issues does not need more than 1.5 grams per kg of protein per day. So if you weigh 60 kgs, you don't need more than 90 grams of protein. And that can be animal or plant-based. Now, a high protein diet probably will cause some form of chronic kidney disease long term. There's not enough data out, but what I can tell you, the studies so far and the investigations have found that the microcirculation in people that have a high protein intake for a long time, the microcirculation is very similar to the early diabetic kidney model, which we call hyperfiltration. And we know what happens to the diabetic kidney if you leave that state, if you leave that diabetic state as is, poorly controlled, that you will, in the hyperfiltration causes kidney damage. I put it just bluntly, kidney damage to the kidney damage. There are various types of patterns you can see on a biopsy, but that's the diabetic, that happens in the diabetic state. So you can postulate that because you got a very similar hemodynamic abnormality, people taking lots of protein, it's likely that you're going to get similar changes as time goes on. There's no fixed data out. This is something I attended a meeting about 4 or 5, just before COVID, and they said that it's probably likely you'll get some form of chronic kidney disease, but it might not look diabetic when you look at it end stage, but there'll be lots of fibrotic changes everywhere. Now, if you look at the American diet is the average protein intake in the US is 2 grams per kg per day. So you've got people eating 180, 1 to 200 grams. It's a lot of protein. They also have a lot of glucose. They have a high calorie intake and a high salt intake. So that's almost like a toxic kidney diet, the American diet. You cause obesity. Obesity is something we haven't mentioned either. That is also a cause of chronic kidney disease. And it's a group of patients that you want to screen. So I hope I answered the question. I just fixated on the anabolic steroid and protein. I'm not going to talk about like Red Bull and the excess caffeine.
Mm-hmm.
That's
another story. Yeah. And what about drugs of abuse, like those that are taking cannabis, which is very popular nowadays?
It does not affect the kidneys.
Doesn't affect the kidneys at all. Okay. Right. You'd like to add anything to that, Doc?
The drugs of abuse that we see indirectly affecting the kidney are things that are stimulants that cause very high blood pressure over time, like cocaine, for instance. That would be a concern.
Okay. And then you mentioned obesity. What can someone with obesity, what are the signs that they can look for that they're having some sort of kidney disease now?
So generally, we said that it's silent early on, but if you're getting advancing kidney trouble, some of the signs you can present with very tired, which is very non-specific, swollen feet, you can be pale, short of breath, itching skin, poor appetite. So especially if foamy urine, if you have a lot of protein in the urine, so especially if you're having a lot of swelling in the legs and a change in urine, whatever decreased amount or change in color, I'd be concerned.
Okay, so we discussed what are the possible causes and who are at high risk and should be investigated. Tell us a little bit about these kidney diseases in the various different categories. Like, what would you find in hypertension? What will it eventually lead to? What would you find in diabetics? What will that eventually lead to, etc.?
So in diabetes, it's we always say when someone is diagnosed with diabetes, so type, if we traditionally classify it as type 1 and type 2, when you're diagnosed with it, you must get kidney screening because, again, diabetes in itself is a silent disease. You may have had it for years and it can cause kidney damage. So what it does in diabetes, Dr. Khan mentioned this concept of hyperfiltration, where your kidneys essentially overwork and it causes a certain pattern of damage. How we see it as doctors is we see in diabetic kidney disease, if you are diabetic, you'll know that your GP or your endocrinologist or whoever is managing you will always do a urine test for you to check the protein or the microalbumin in the urine. And we get concerned when that starts to increase over time, when your kidney starts to leak more protein. And then we see with that the kidney function starts to decline associated with it. We see the blood pressure starts to increase as well. So that's the usual things that we see. So diabetes is not a disease that's in isolation. As much as if it's affecting the kidneys, it's affecting the nerves, it's affecting small and large blood vessels. So one of the other signs is looking into someone's eyes that's diabetic, and you'll see what we call diabetic retinopathy, or the blood vessels at the back of the eye will suggest that there's diabetic eye disease. So it's something that can also be screened for and picked up early in a diabetic. Now there's new medication that's come along. Well, not so new, but before we didn't have much to treat chronic kidney disease, but we've got some new treatment in our armamentarium that can slow the progression of kidney disease, especially in diabetics. The issue in not only diabetic patients, but in patients with chronic kidney disease is they don't often die of their kidney disease. The highest mortality comes from cardiovascular risk, so heart disease, like myocardial infarctions, etc. So it's not just managing one aspect of the disease, but seeing the patient holistically.
Okay, we're going to take a short break now.
Radio Al Ansar, 24/7, 365.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Get ready to elevate your fitness game at First Fitness in Durban's Berea. With a spacious free weight area, award-winning equipment, and exclusive ladies-only parking and training level, we've got everything you need to crush your goals. Hit the ground running on our outdoor track or unleash your inner warrior in our MMA and boxing dungeon. Plus, enjoy high security and ample parking. And don't forget to refuel at our halal coffee and health restaurant for the best in coffees, smoothies, and healthy eats. Join us today and redefine your fitness journey. First Fitness, dare to be extraordinary.
Save the date. Hajj Seminar 2026 is back. Saturday, 11th April, 8 a.m. to 1:30 p.m. at 207 West Road in Overport. Proudly brought to you by the Al Ansar Foundation and the Capital Group of Companies.
Radio Al Ansar. Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Welcome back to Medical Files. I'm your host, Dr. Arshad Bhayat. Today we are talking to Dr. AFZAL Khan and Dr. ZAHEERA CASSIMJEE, both nephrologists, and our topic is prevention of kidney disease. We've discussed so far, the high-risk groups, and we've also spoke a little bit about what can be done in certain cases. We've also discussed how using supplements can cause a problem and what to look out for. We're going to go quickly to a few questions that we have here. We have one from one of our listeners. I am 75 years old. End of last year, I was diagnosed with stage 3 chronic kidney. I don't have pressure or sugar. How serious is it? Can I fast with stage 3 kidney disease? Dr. Kassimjee, would you like to answer that?
So I think any question about wanting to fast, that's reasonable, but I think your doctor would have to see you. It's difficult to say. Stage 3 is very broad. It's a wide range of kidney percentage functions that you can fall under. There's stage 3A and stage 3B. If you're falling on the higher level, it could be safe. It all depends on your ability to excrete water, that you're not getting swollen and short of breath, that you're able to hydrate on either side of the fast. And you said you're not hypertensive or diabetic. That's less of an issue. But the main thing is, it's hydration in someone, obviously, that's not diabetic or hypertensive, if you're able to maintain that on either side. Sometimes if you're old, if you're 75, a slightly low GFR or percentage function is acceptable. It also depends on how much muscle mass you have. I'd say it's an individualized a decision to make. It's not something that you can say at this percent you can and at this percent you can't.
Yeah, just to add to that, most of the GPs have been made aware, especially before this Ramadan, how to do or how to calculate the risk factors when it comes to diabetes and fasting. And there's a whole series of questions that will be asked, not only regarding to the kidneys, but you need to do trial fasts before you start your full fasting. You need to check your sugar regularly. You need to make sure that you're not becoming hypoglycemic. There's a whole process that needs to be followed. So inshallah, if you can contact us or you can contact me personally, Dr. Bhayat, I will run through that with you, inshallah. Okay, our next question that we have here is regarding... okay, I think Dr. Khan, maybe you can answer this one. It is said that cystatin C test measures kidney function better than creatinine. in chronic kidney disease and recommended in the USA. Can you elaborate on this test and why is it not used in place of creatinine here in South Africa?
It is a far more accurate way of measuring kidney function, but the costs can be a bit problematic. Ideally, we should do it in everyone. And in a patient where you're uncertain of the level of kidney dysfunction or function and you want an accurate measurement, then most certainly it can be done. Can I just go back to the last patient, the last person who phoned about stage 3? You can probably get away fasting at stage 3. Stage 4 and 5, that's more advanced kidney disease. It can be a bit more problematic, especially with control of what we call potassium levels. Even in a patient who's not diabetic or hypertensive, when you eat glucose or any sort of calorie type food, that stimulates insulin, and the insulin then has a potassium lowering effect. So if you are fasting and you've got kidney disease and you have a tendency to a highish blood potassium, and if there's nothing endogenous that can suppress it, then you are at risk of having a high potassium. Would you agree, Dr. Gasser?
I definitely agree. I think definitely stage 4 is something you have to see a doctor first. I have had a few patients that have fasted this Ramadan, and I've asked them to repeat bloods after a week to see that they're doing okay, and it's individualized to see if they are coping. To get back to your question about cystatin, it's a lot more expensive than a creatinine. Creatinine is maybe 100 Rand, and cystatin is 350 to 400 Rand. So that's probably why it's not widely used. But the caller is correct. It's far more accurate than creatinine that's affected by muscle and food intake. So if there's some discrepancy that you're finding, the creatinine is not making sense, or your percentage function of the kidney is not making sense, a cystatin C is a good test to do.
We have another question here from one of our listeners. Salams, doctor. I am diabetic and I take magnesium glycinate, and is it okay? And I'm also taking Foxiga. Is it okay to take this medication for the kidneys?
Absolutely. Is the patient's kidney function normal? Do we know?
No, they're not mentioned here. They're not mentioning it here.
Interestingly, Forxiga, which is what we call a SGLT2 inhibitor, increases the magnesium. So I would also just watch it. We've had patients that have had low magnesium for years and that have started Forxiga or dapagliflozin, whatever kind of SGLT2, and their magnesiums for the first time ever have corrected. So it's something interesting to actually check in your patient.
Okay, I hope that answers the questions for now. Doc, would you like to carry on with what we were discussing before we went on to the break? We're talking about the different, like how you move from being diagnosed or investigations to your end stage or your dialysis. Dr. Khan?
Okay. Whatever cause of the kidney diseases, there are 5 different stages: 1, 2, 3, A, 3, B, 4, and 5. Stage 1 and 2, the patients often have absolutely no symptoms whatsoever. They don't know it, and it's picked up just by accident. Now, in fact, that's the best stage for us to see the patient, because there's quite a lot we can do. And stage 1, stage 2, basically, the patient's blood pressure has to be well controlled. If the patient's diabetic, that has to be well controlled. If the patient's overweight, patient has to lose weight. If the patient is taking lots of pain tablets, we have to adjust that. If the patient has things like enlarged prostate that might cause some obstruction, that has to be addressed. Then there are certain classes of drugs that are used, and we put it under the label of ACE inhibitors or A2 blocker therapy. Then, of course, the newer drugs, as has been mentioned already, Forxiga is a good drug to use in stage 1, stage 2. It's not only the renal protective, it has cardiovascular protective effects as well. So that is stage 1 and 2. Stage 3A, 3B, roughly the same, though you may well want to add another group of diabetic drugs. That's what we call GLP-1 agonist. That got some kidney protective effect. It also has cardiovascular protective effect as well. So that's 3A, 3B. Towards stage 4, your options are becoming limited now. And in fact, you might not be able to use Forxiga in this group of patients if what we call the GFR is too low. Although some people believe you can use it to the very end. So there's not much more you can add in stage 4. Not much more you can add. Stage 5 is end-stage kidney failure. And at that stage, the patient will definitely be unwell and will need some form of dialysis or transplantation. That's just a gist of the different stages.
Okay.
We often see patients coming to us at 4 and 5, much too late. And this is a global problem.
Okay, for the benefit of our listeners, can you just basically explain what is stage 1, stage 2, stage 3, and stage 4 and 5? Dr. CASSIMJEE?
It's essentially the percentage function of your kidney. Stage 1 would be 90. Stage 2 would be 60 to 90. Stage 3 would be, it's wide, stage 3A and stage 3B, but it's usually under 60, and stage 4 would be under 20, and stage 5 would be under 15.
So,
20 to 30,
so usually
15.
when these patients go for the UNE test and so etc., they'll have all the values, your urea, your creatinine, and then right at the bottom you'll have what is known as your GFR. Are you talking about that value?
Yes, that's the value. So the GFR, we tell them crudely, it's a percentage function of your kidney. It's just a bit easier to understand. So some patients can present late, and if they're older and their GFRs are on the low side and they worry, will they reach dialysis? That's what everyone tries to avoid. And, the ways to avoid it, as have been mentioned, obviously, is to control their risk factors, essentially. Blood pressure, sugar, and avoid anything that can damage their kidney. So it's dehydration, it's and things like anti-inflammatories, even things like med lemons when they're sick have high doses of aspirin. So things that we take innocuously can still also damage the kidney. So you're able to sometimes live for a long time with chronic kidney disease if you're able to manage your risk factors. And our aim as nephrologists is to prevent progression to end-stage renal disease.
Okay, we have a question here. Is age-related kidney function deterioration in elderly, non-diabetic, non-hypertensive, or any other risk factor a cause of kidney failure in seniors?
Yes. Simple answer is yes. You lose a certain percentage of kidney function from the age of about 40 onwards, very slight. So that by the time you're in your 70s, you'd have lost about 25 to 30% of kidney function, normal aging. There are people looking at using Forxiga in this group of people. I don't know enough about that yet, although I have patients on it. The data is scattered. I don't know if Dr. CASSIMJEE has any idea or thoughts on that.
In theory, it's good, I think, for Forxiga. Something for the public, it's something that is called an SGLT2 inhibitor. It's also a diabetic drug, but it decreases the pressure in your kidney. That's what it does. And it's been shown to have good heart effects, not only diabetic effects, but also kidney effects. It's a very good drug, but I would sometimes, there's certain groups of patients where you're a little bit more cautious. For instance, if they're older and on lots of diuretics, if that kind of population group, I'd just be slightly more cautious there. But in theory, it's been used widely across chronic kidney disease, and it's probably going to be indicated for almost all chronic kidney disease.
So you're saying it's possible for someone who's not a diabetic to use this drug to improve kidney function?
Yes, they've looked at it at certain what we call glomerulonephritis, which is inflammation in the kidney, certain types of it, and they've shown good effect in some.
Right, that one of our listeners that had asked the question earlier, about fasting, etc. She said her GFR is 33. So will it be okay for her to fast with the GFR of 33?
Should be.
Yeah.
Should be okay.
Okay. Right. So let's move on now to our cancers of the kidney. How common is carcinoma of the kidney, and what are the risk factors that cause it?
It's uncommon. I think you're talking about renal cell carcinoma. That's the adult form. It's unusual. It's very difficult to pick up, and it's often picked up coincidentally on a scan. You see a mass or a lump or something. Sometimes the patient has some blood in the urine. Sometimes backache. If the tumor is impinging on the capsule of the kidney, it's often diagnosed late. There's treatment for it. There's treatment, fairly effective. But it's often picked up later, and often they spread elsewhere. It's spread beyond the kidney, and if it's spread beyond the kidney, and it commonly does that, then the treatment is more difficult. There's a variety of therapeutic options. Overall, if it's picked up early, prognosis is reasonable.
Okay, I hope that answers your question. We have another question here. Salams, what's the basic test done to pick up any infections in the kidneys? Also, what test is done to check kidney percentage functions?
So the basic test we do would be urea and creatinine, which you can do at any standard lab. If you're worried about kidney disease, it's worthwhile to test the protein in your urine, so protein creatinine ratio. And if you're looking for infections in the kidney, you send off your urine for microscopy, and they culture it and see if they grow any bugs in the urine. So the mainstay of picking up an infection, the basic way is at your doctor's, they'll do what we call a dipsticks, where they put in a dipstick and see if it comes back positive for anything to suggest an infection, which they can treat you with. If they think there's any complicated infection, then they can send it off to see what particular bug it is. Obviously, certain people are more predisposed to infections and would be at higher risk, like diabetics. Women also are more predisposed to infections.
Okay, I have another question here. Doc, my GP told me that my kidney function is 60%. Would it be possible to bring that up with meds? But they haven't given the age or anything like that.
No other medical info.
No, nothing else.
In theory, yeah, possible.
Okay, so what's good kidney, lifestyle? What are we looking at? Drinking how many glasses of water a day, or is it any fluid? What foods to abstain from? Things like that.
So you're talking about somebody who's got no medical problems.
Yeah, no medical problems. How to
Fit
prevent?
young person.
Yeah, how to prevent this kidney problems in the future?
Well, a healthy diet, maintaining a normal body weight, body mass index we call it, regular exercise, avoidance of stress. It's a general, just healthy lifestyle. Avoid taking pain tablets, taking the supplements we spoke about earlier. Basically, it's a healthy lifestyle. This 3 liters of water thing, I don't actually believe in that. There's water in everything you eat, in everything. And if your body lacks enough water, salt and water in the body, then it'll make you thirsty. You'll drink more. I advise patients that a liter of water a day, a liter, and plus whatever else you're drinking. There'll be juice, tea, coffee. There'll be salads. Salads mainly water. Fruit is water. So you'll make up 3 liters in that way. It's very hard to drink 3 liters a day. It's very hard.
Yeah.
And sometimes what happens if you do that, then you dilute your blood biochemistry, and mainly the salt level, and then you get side effects from that. minor, tiredness, etc.
Okay, I hope that answers the question for you. We're going to take a short break now.
Radio Al Ansar, 24/7, 365.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
Bismillahirrahmanirrahim. ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين.
Car won't start.
Kenfield Auto.
Noisy brakes.
Kenfield Auto.
Due for a service.
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop. Follow the red and white board in the passage at 236 Brickfield Road, Overport. Call Shafi on 031 207 2399. Kenfield Auto.
Teaching you something new every day. Radio Al Ansar.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Welcome back to Medical Files. I am your host today, Dr. Arshad, Bhayat, and we're talking to Dr. AFZAL Khan and Dr. ZAHEERA, CASSIMJEE, both nephrologists. And our topic today is prevention of kidney disease. If you have any questions, queries, doubts, please do send us your questions on 060-904-1056. That number again is 060-904-1056. Docs, we have another question here. I attend a government hospital. I've been told that I have chronic kidney disease, and I've also been told not to drink a lot of water, but I don't understand how that works.
Well, it really does depend on your percentage function. Sometimes when the kidney percentage function is very low, the body can't carry out the functions of what the kidney is supposed to be doing, and one of which is to excrete water. So you may be urinating less often, and if you drink too much water, the water will build up in your body essentially. So this is advanced kidney disease when you start having swelling of the legs, and you probably may be close to dialysis at that point.
Okay. Another question here is, I'm a diabetic. I've been taking metformin for many years now. I've been advised by my doctor not to take it as it is damaging my kidneys. Is there any truth to this?
No. Depends what level of kidney dysfunction the patient has. But metformin does not damage the kidney in any way, no.
If the percentage function of the kidney becomes very low, then there's a theoretical risk. But that has to be like usually under like stage 4 onwards.
Yeah.
So, but it doesn't damage the kidney per se.
No,
there are some risks involved though.
Mm-hmm. Okay, I hope that answers the question for you. Let's talk about a little bit about dialysis. We know that dialysis has to occur every second day or every third day. A lot of people feel restricted in the sense that when the family is going on holiday or if they're going overseas for Umrah, etc., that they have limitations as far as whether they can go or not. And they've heard of, especially one of the listeners who had called in earlier, in one of my earlier shows, spoke about registering with some sort of organization which allows you to then get your dialysis overseas, etc. Can you elaborate a little bit on this?
Patients on hemodialysis can certainly travel. I have sent patients to Mauritius often. To travel around South Africa is straightforward. You have to, if you're traveling to Johannesburg or Cape Town or whatever, you need to book into a unit there where you're going to be staying nearby. Patients who travel to the UK and Europe and USA, there's a cost factor because visitors have to pay. Now, to travel to Europe, each hemodialysis session costs between 200 to 250 euros per session. And sometimes the patient needs 3 times a week. The cost factor in the UK and US is roughly similar, US $200 a session. So it's not impossible for patients to travel and have dialysis, but the cost factor traveling to the Western countries can be prohibitive. Some patients go to Malaysia, it's a bit cheaper. It's a long flight, so patients often have to dialyze the day they get there. But there's no reason why a dialysis patient cannot travel and have dialysis wherever they're going.
Okay, so are you talking about patients on medical aid or even government patients?
Well, to go overseas, medical is not going to cover that. You have to cover that yourself. It's a different currency, and the costs are prohibitive often per session.
Okay. And would you like to add anything to that, Dr. CASSIMJEE?
I mean, we say dialysis is always not the end game for a patient with chronic kidney disease. The ultimate treatment or modality should be a kidney transplantation, and that would give a patient more freedom of movement, more normal quality of life. The other modality of dialysis is something called peritoneal dialysis, where people do that at home and they instill bags into their abdomen and drain it. That also gives patients a lot of more flexibility, but traveling with that on a plane, etc., may prove a bit difficult to carry so many consumables. One can obviously organize it wherever you are flying to, but it certainly comes with its challenges, but they can be overcome.
Okay, so we almost at the end of the show now, so I'm going to ask both of you to each give your concluding remarks. Dr. Khan, would you like to begin?
Well, as I said at the beginning, the purpose of World Kidney Day is to highlight that chronic kidney disease is common. There are different stages, and it's commoner than we think, and we would like to diagnose it earlier, and therefore we would advise patients who have diabetes, hypertension, obesity, the elderly, or patients with HIV, patients who have had a previous stroke or heart attack. Those 5 categories of patients would be the ones that we would like to screen, so that if there's a kidney problem, we pick it up earlier, and the outcome is far better if we get them early.
Okay, and Dr. CASSIMJEE, your parting comments?
In a similar vein, I think it's everyone's responsibility is their own health. So to start off, know your own numbers, whether it's your blood pressure, your sugar levels, and if you have any risk factors that we've mentioned, then you should know what your kidney function and your urine is doing. And take care with any over-the-counter medications. I would just stress that enough in our patients.
Okay, to all our listeners out there, I hope that this has given you some information and give some education regarding kidneys and kidney disease prevention and what to look out for. I would like to thank our guests, Dr. AFZAL Khan and Dr. ZAHEERA CASSIMJEE. Jazakallah for joining us in studio. And to our listeners out there, please remember that next week, same time, between 8 and 9, we have our medical files brought to you by the Islamic Medical Association. And I would like to take this opportunity also to make dua for all those out there that are suffering from any sort of disease, any sort of illness, any sort of discomfort, that the Almighty Allah gives them a complete shifa. I'd like to thank my technician today, Asif, for everything. And inshallah, hope and look forward to having you on the program again next week at the same time. From me, your host, Dr. Arshad Bhayat. Assalamu alaikum wa rahmatullahi wa barakatuh.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.